This information is not meant to replace the advice from a medical treatment team. Caregivers should be aware of any special considerations of the veteran and themselves. Please consult a medical treatment team regarding any specific concerns. When helping a veteran out of bed, you could prevent falls and injury by following these tips. Make sure the veteran is wearing non-slip socks or shoes. Have equipment such as a wheelchair or walker ready and within reach for transferring out of bed. Use a transfer belt as needed. Preparing this equipment ahead of time while the veteran is laying down can improve safety for an out-of-bed transfer. Caregivers should follow proper body mechanics by staying close to the veteran, keeping feet shoulder-width apart, bending at the knees, and keeping the back straight. Have the veteran do as much as possible during the transfer. Tell the veteran you will be helping them sit on the edge of the bed.
Okay, I'm going to help you sit on the edge of the bed.
While the veteran is lying on their back, have the veteran bend their knees up. Then, have the veteran lift their buttocks off of the bed and move their hips and upper body toward the edge of the bed, but leave enough room to safely roll to their side. Have the veteran roll towards you. Once lying on their side, the veteran should keep their knees in a bent position. Then, have the veteran lower their legs off the side of the bed and push up on their elbow to a sitting position. Once seated on the edge of the bed, tell the veteran to place hands on the bed and, if possible, place their feet flat on the floor to support themselves. Pause to make sure the veteran is stable sitting on the edge of the bed. If you're planning on getting the veteran out of bed and a transfer belt is available, place it around the veteran's waist. To place a transfer belt, stay close to the veteran. Place the transfer belt around the veteran's waist and secure the transfer belt by threading the belt in through the teeth part of the buckle and out through the smooth part of the buckle. Tighten the transfer belt until snug, but with enough room to fit 2 fingers through. Do you need more information on available VA resources and training regarding transfers? VA can provide veterans with necessary adapted equipment such as a bed handle. Please consult your VA healthcare provider for a referral to physical therapy and occupational therapy